and from all different walks of life. And sorry if you saw me looking down, that's because one of my cats is here. She always somehow knows when I'm about to do a presentation, so she needs to bother me and let me know that she's there and she wants to be seen. So if you see her jump up, um, hopefully we don't get too distracted. But thank you so much for having me here. I'm so excited to be partnering with this association. I myself, I don't have spina bifida, but I have an autoimmune condition called IBD, and so I'm really passionate about working in the chronic illness space and working with kids and adults that are struggling with chronic health issues. So thank you again, and let's just kind of jump on in. As I kind of briefly mentioned earlier, but I know not everyone was here then. If you're interested in just learning more about what we do at GIP, feel free to scan these QR codes. However, I'll send all of this over to the team here afterwards. So if you don't want to look into that right now, if you're interested in maybe taking a look later, no worries. You'll get those links as well. And for the sake of time, we're just going to kind of jump on in. So I'm just going to kind of start here just with an overview of our talking points today. But as a reminder, feel free to interrupt with any questions if you need, but we'll definitely save time at the end too. So I'm just going to give a brief little intro into what my work looks like at GIP or GI psychology. And then we're definitely going to dive in and talk a little bit about, what that gut-brain connection looks like and how how it really looks in terms of spina bifida. And so we'll talk a little bit about that. And we'll also talk about how our emotions can affect our digestion and vice versa, how we help here, what treatments can look like, and I'll do a little case study of a patient that I think you'll find kind of relevant and close to home, and then how we can get support as well. All right, so this is just a little bit of info on the practice here. So at GIP, we focus exclusively on GI-related conditions and other chronic medical conditions or complex medical conditions. We are fully telehealth based, so we can cast that wide net and see patients across the country, as well as amongst the clinicians here, we're I think about 15 or 16 now. We can see patients in all 50 states plus DC, which we're really excited about. As I mentioned earlier, so I personally see kids and adults, but as a practice, we see ages 6 and up. And again, we're fully virtual as well, so we can tailor things depending on developmental level and things of that nature. While we do specialize in the gut-brain interaction and disorders of gut-brain interaction or DGBIs like IBS and other functional GI conditions, we also specialize in structural or more complex medical conditions, things like inflammatory bowel disease or IBD, certainly things like spina bifida, chronic pain syndromes, and other medically complex conditions as well. And so typically we kind of say, the patients that really most often need that coordinated medical, behavioral, nutritional support and just overall wraparound care, those are the patients that we see most. And because our clinicians are all GI focused or trained in treating GI conditions, we're really able to speak that same clinical language that you often do. So we're often discussing things like visceral hypersensitivity and pain and anxiety cycles and different types of GI symptoms like functional nausea or avoidance patterns that we see in terms of social life or outside of the home setting. So we really try to make that collaboration appear seamless and help families and patients feel like everyone is really aligned on that unified care plan. So we're really passionate about that. Here is a little bit about what our mission looks like. So overall, we really strive to improve access to specialized psychological care for patients with chronic GI conditions and chronic medical conditions, excuse me. And so this often looks like support for, children's, teens, and adults that are experiencing symptoms like nausea, diarrhea, constipation, accidents, abdominal pain, urgency, etc. So really that focuses on those GI symptoms specifically. And then of course, reducing that emotional burden that often comes with those symptoms and with lifelong challenges or GI challenges specifically. And we're also very passionate, as I mentioned before, too, about that care coordination piece as well. So we see the mental health care, of course, as not just a complementary treatment, but really as a necessary treatment when we're dealing with chronic health conditions. So that means partnering not only with our patients and families, but also with medical teams and other professionals is so important to us to really deliver that integrated mind-body care. So let's kind of dive in and talk a little bit more about what DGBIs are, and I'll kind of share too
Yes,
about why
ma'am.
I'm talking about this.
Will you
Yeah,
get my dinner?
was there a question or I think someone just might not be muted. So what is a DGBI? So DGBI stands for Disorders of Gut-Brain Interaction, which means in simple terms, when we have a condition where our guts and our nervous systems are not communicating as smoothly as they could be. So these are very real and very common digestive conditions, even though we know tests and scans or labs very often or always look quite normal. The symptoms are very much real and are certainly very disruptive at times. We used to call these conditions functional GI disorders, but that older language caused so much confusion. And because of that, we found that it often made people feel like their symptoms were kind of dismissed or they felt oftentimes very invalidated, especially in medical settings. So now we understand that full picture so much more about how that nervous system plays a role in things like our digestion, our pain, our nausea, bowel function, et cetera. And so we feel that that term definitely fully encompasses what we're actually seeing with those functional symptoms there. Now, why am I talking about this here? Well, for individuals with spina bifida, this is very important because we know when nerve signaling happens, when nerve signaling specifically to the bowels or the bladder is effective, that communication between the brain and the gut can be even more sensitive, which then contributes to those symptoms. So oftentimes we're seeing an overlap between spina bifida and functional GI symptoms or even bladder symptoms, right? So IBS is obviously a very common DGBI that most people know of, but also things like functional abdominal pain, ongoing nausea and vomiting that really doesn't have a clear structural cause attached to it. These symptoms are very, very common. So we know that they currently are affecting about 40% of adults and roughly a quarter of children in the nation right now. And really what I want everyone to take away from, learning a little bit more about what DGBIs are is that because this involves that nervous system, even though it can be very, very disruptive, there are so many ways that we can support and have that research back to prove that to really improve our gut-brain communication. So that's very important here. And so now we're just going to talk a little bit more about what that gut-brain connection looks like. And this is definitely something that I think a lot more people are hearing about, but maybe don't fully understand yet. So when we think about gut-brain communication or that gut-brain connection, we refer to this often as the gut-brain axis. So this is that constant communication between the brain, our spinal cords, and our digestive systems. And for a lot of folks, this communication can run very quietly, kind of in the background, almost just like white noise. And so digestion just kind of happens, and there's really not a lot of awareness, conscious awareness there. However, oftentimes, especially when we have chronic medical conditions, that nervous system can become very, very overprotective. And so when that tends to happen, the gut then starts to react more strongly to even typical sensations in the body. And that is what we call visceral hypersensitivity. Um, Now, at the same time, our brains can then become more watchful of the gut. And so we often see this like close monitoring of sensations and changes happening. And that's what we call the hypervigilant piece. So that is almost like this heightened state of anxiety where we're carefully, maybe even over kind of paying attention to what's going on in our body. And those responses are not intentional and they're not signs of damage either necessarily, but this is really, these are those protective systems that are just kind of like doing a little too much. And especially when we've had, complex medical histories that have been, longstanding in our lives. And naturally, we know that it's very common for our brains to want to protect us from any perceived threat in the body because we've learned so much over time that we can't really always trust what's going on in the body, or we have these complex medical conditions that are very unpredictable in nature and that we really have to pay attention to in a lot of ways to make sure that we're, doing the best for ourselves as well. Now, with spina bifida specifically, differences in that nerve signaling can make that communication even more sensitive. So this is when we often do see symptoms like constipation or diarrhea or urgency, sometimes even, some accompanying bloating, abdominal pain, even if there's not necessarily a new medical issue going on. Oops, I just lost my slide there. And, because symptoms are driven by that nervous system signaling specifically, this is why approaches that really help calm and also retrain that gut-brain communication and connection can really reduce symptom intensity and symptom burden, and then overall improve daily life functioning and comfort over time. And so I'm going to start a little bit of a discussion here about some of the gold standard treatments that we know have been the most effective for GI symptoms. So the first is cognitive behavioral therapy, or CBT, which everyone probably has already heard of in some capacity, but this is different than traditional CBT. So this is CBT for GI conditions specifically. So this therapy specifically helps our guts by working through that nervous system in a different way. And our main goal is to really calm an overactive nervous system, of course. So when the nervous system then begins to feel safer, what happens? Well, the gut becomes less reactive, less sensitive, and then we don't have that symptom interference any longer, or it's much more muted or decreased. What's also really nice about this condition-specific CBT is that we do a lot of work with our patients on reducing that hypervigilant piece, or that kind of overthinking about symptoms as well, because we know when our body is in that almost constant state or fight or flight, excuse me, and constantly kind of checking the body for signs of danger, that gut-brain loop is continuing to be activated in ways that we don't really want. So we want something that can really interrupt that cycle in a healthy and gentle way, which is this condition-specific CBT. Another important piece here is easing anxiety or stress surrounding body signals or accidents. We know oftentimes, as I kind of touched on earlier, with having, longstanding chronic health conditions, that we tend to fear the sensations even themselves, right? And that then can increase things like urgency or pain or whatever other symptoms might be at play or sensations might be happening. And so with CBT, with this type of CBT specifically, we can really focus on helping somebody change how they actually respond to those sensations, rather than trying to eliminate those sensations entirely. So this is, again, very gentle, very patient focused, something that should feel very validating and where the patient can really feel like a partner in their care with us. And some of the ways that we do this, so things like different types of relaxation techniques, different types of specific breathing tools that send these safety signals to that nervous system so we can calm everything down and really feel like we can have that sense of control back over our bodies and symptoms. Another piece to this puzzle that often is really effective is kind of a gradual exposure technique that we often integrate with patients. So this can involve things like, practicing trying to use, the bathroom in maybe new places that tend to cause a lot of fear avoidance, or maybe gently trying to reintegrate eating before an outing, or even just staying more present through like more mild symptoms. So again, very patient-led and focused. We're not forcing, of course, anything on that individual, but things that they really, really value that they miss or really want to regain in their life is something that we try to gradually kind of work on through exposure as well. And over time, what this work specifically does is it really teaches our brains that those situations are manageable and are no longer dangerous. So really overall, the big takeaway with CBT for GI is that we're trying to help the individual build confidence, reduce pain and discomfort, and really help that body feel safer so that that gut-brain connection can kind of settle down in the ways that we'd like it to. Our other gold standard treatment for treating GI symptoms and conditions is something called clinical hypnosis, which everyone is usually really excited about, but also a little bit, hesitant about as well. So I always start off with saying, because I know when most of us, myself included, before I did this work, hear the word hypnosis, we're thinking of like magic or stage shows, right? So that is definitely not what this looks like whatsoever. So clinical hypnosis is very, very different. This is research backed. This has been a tool that's been used in medical and psychological care for years and has a lot of evidence-based research behind it to prove its effectiveness. And we know that it has been proven to help people enter this very safe, comfortable, and focused, relaxed state. So it's almost kind of like being absorbed in a story or really deep in imagination. We've all kind of been in that place before at some point or another in our lives. This is just more intentional. So again, it should feel similar to maybe something that we've experienced before. Like, let's say we're driving the same route to work every day and we're really comfortable with that route to work. And we're really just focused on the nice, beautiful scenery that we're seeing on that highway that we drive on every day. So we're so focused, but not unconscious, right? We're not, getting in an accident necessarily or hurting ourselves or endangering ourselves in that car. So we're conscious enough, but we're still feeling really relaxed and calm. And we're just kind of doing something that feels natural to us. And that feels really good. So what happens? We kind of just miss our exit and then we realize, oh, we have to turn around and go back. So it's kind of like that calm or really focused state, or even if there's something that we really love to do, like a certain book that we love to read or something that we really love to watch, that we can just kind of get lost in and tune out the world around us, similar to that as well. And so what we do with clinical hypnosis is we use helpful images that are patient specific, like specific interests or things that are meaningful for patients, as well as suggestions specific to the patient's needs and their symptoms that they want to improve or decrease to really support how that body feels and functions in a more easy and natural way. So oftentimes we're using clinical hypnosis with patients who experience pretty much all the GI symptoms we've already talked about. So there's really not a lot we can't use it for. So certainly like diarrhea, constipation are two of the big ones that often come up, urgency, accidents as well. And also that co-occurring mood related impact too, like that anxiety and hypervigilance piece, or even depression, grief, etc. And so in the spina bifida community specifically, so where we know that, neurogenic bowel can play a role, clinical hypnosis can be really, really effective and oftentimes is very effective. And my patients really enjoy this piece to our treatment. So with that piece of that neurogenic bowel, stress in our nervous systems are very, very sensitive, right? And so sometimes those symptoms can be really, really hard to manage. And hypnosis gives us this kind of way to work with that mind-body connection that's very patient-led, very relaxing, almost like if you are someone who likes a massage, kind of like a massage for the mind, and really helps calm and settle down that nervous system and give that gut feeling of just being a little bit more in sync with the body. And again, giving you that comfortable, calm control back. And we can certainly use it for other things too, like, bladder impact as well. For our peds patients, we definitely use both of these treatments too. So, certainly will be kid friendly, always collaborative. So really not that different than working with adults. Patients are never feeling out of control. They're actually even more in control because they're learning how to access their own kind of internal calm and shift the way that their brain and body responds to symptoms. I'm kind of just like the one that's conducting things, right, and helping guide them, but you're very much in control. And kids often respond really nicely, which is great. And we'll talk about that soon too. And so how does this really help support the gut-brain connection? I kind of briefly touched on this, but just want to give a little bit more insight here. So um, when there is that very strong gut-brain kind of negative feedback loop happening that we touched on earlier, especially with things like spina bifida, where we know, diarrhea, constipation, or even accidents can be more complex. We know there's has to be this physical and neurological impact there, right? So, doesn't necessarily mean with that, neurological piece that the brain's role should or does completely disappear. It's really that the emotional burden, that stress or embarrassment or whatever that is, even if it's sensory overwhelm too, which we often see, really makes those symptoms harder to manage. So, just like I mentioned earlier, hypnosis is not mind control, it's not stage magic. It is really this focused, relaxed state where we can really tap into an individual's preferences in terms of imagery and suggestions to really downshift that nervous system. So, with a patient, this can be something like really trying to help them feel more in control of their body's cues, helping somebody reduce anxiety before using a bathroom at work or school, etc. And the way that I usually describe this to patients too is that, this is kind of what helps our brain and our guts, or for kids, our brain and our bellies talk to each other in kinder ways, or our brain and our bladders, whatever it is, right? So we know that this is something that's really effective, and we've seen how it can really reduce those pain signals as well, and actually help improve or enhance digestion, because we can really help those muscles relax, help ourselves feel more in control, and help our symptoms feel more manageable. And what does the research actually say here? So, we know that, of course, neurogenic bowel is a key challenge in spina bifida, but we don't quite yet have clinical trials showing how condition-specific CBT or clinical hypnosis um, can be helpful for spina bifida specifically. I'm very hopeful that that will change and soon enough. Right now, where the research is mostly focused is on bowel management protocols. So, like irrigation or suppositories, which, can and certainly do improve confidence in many individuals, right? But there's certainly more that we'd like to see, out there research wise. Um, However, though, that emotional stress or embarrassment or anxiety and hypervigilance to those body cues, we know is very much an interference to those physical routines. And so that's where our psychological interventions really, really come in. And we have had a lot of really promising research out there on similar conditions, like with a functional GI disorder like IBS, where we have seen that calming that brain really does help calm that gut. So we know that these are tools that are essential to really supporting quality of life in neurogenic bowel. And even with that research still not quite out there emerging, we know, especially with what research we do have at our fingertips, and combining those mind-body techniques with, of course, standard medical protocols and collaboration with medical providers really does help patients feel more in control and really reduce that fear around symptoms and engage in life more fully. And I want to also just talk a little bit about how we adapt for peds, even though I know this is an adult group, but certainly some people are always interested in hearing how some of these things look like with our peds patients too. So I kind of touched on this earlier, but kids especially are very, very well suited for mind-body work because imagination comes naturally to them, right? So creativity and play are always going to be a huge component here. They're not extras at all. Even if we're not doing things like clinical hypnosis, that should really always be the case for any pediatric therapist. That play and that creativity is really those core mechanisms that make these approaches super effective, especially for kids. So, sessions are always going to be adapted to that individual child and their developmental age. And so that can include like pacing of the exercises, a specific way, how long we might spend on each skill, types of imagery or activities that we use, etc. So it's not totally different than what we would do with an adult, but certainly we're going to make sure that we're paying attention to that developmental age, especially in kids. So we really are going to support that autonomy and their engagement and not force that child in a rigid structure. And what's nice about the virtual piece is that oftentimes we get to then see what that home environment, of course, looks like because most of our patients are meeting with us at home. And especially if we're working on certain fears around toileting or other things that, generally have to occur at home, like eating or, again, going to the bathroom, it's much easier to actually do that from the comfort of their own home. And then also just nice to kind of see how they respond in their environment or in their bedroom or, with their toys or supplies nearby as well. Another big part of our treatment, especially with kids, is really working on understanding how those symptoms show up in that child's world, which is kind of a little bit connected to what I just mentioned too. So helping that child notice their body signals with curiosity rather than fear, and then that gentle reduction of any avoidance or escapism, while still reinforcing routines that support that safety and predictability piece. That's so important, especially when we have chronic health conditions like spina bifida. And certainly, families are always going to play a big role with PEDS patients. So, parents are active participants in reinforcing skills outside of sessions, especially for the much younger patients. So, a lot of what we do is not just with that patient, of course, but also with parents. So, a lot of parent coaching, like focusing on shaping supportive routines and responses rather than trying to control those symptoms. And of course, as we can imagine, when we can really partner with families, just like we partner with medical providers or specialists, on that patient's treatment team, that patient, that child is going to more easily feel safe and capable and really understood, which is so necessary for the treatment to be effective. All right. So I'm going to kind of dive in now to a patient story or a case example because I always find that these are really helpful to fully understanding the work that we do. This has been certainly adapted and de-identified, excuse me, due to HIPAA to protect that patient confidentiality, but it is based on a patient of mine that I've treated before. So I'm going to talk about a patient named Michaela. So Michaela is an 11-year-old girl. She's neurodivergent and she also has spina bifida. She was referred to us for persistent accidents and emotional dysregulation, even though her parents were very carefully following a medical routine. And one of the key components here, especially with that neurodivergent piece, was a lot of instances of sensory overwhelm. So when I say sensory overwhelm, I'm really referring to how Michaela's nervous system processes multiple internal and external sensations at once. So almost like processing physical sensations of a full bladder or belly, along with the sounds and movement of a busy morning, and this like emotional pressure to really get things right. And when a lot of those cues would kind of stack up or layer on top of the other, as they often did, her body would go into this stress response, which then often leaded to either, shutdown or avoidance. Our work, uh, my work with Michaela, I should say, really was focused on helping her learn how to interpret and respond to those sensations with more flexibility. So we did, of course, use a lot of that GI-specific cognitive behavioral therapy as well as clinical hypnosis to really emphasize body trust. And emotional safety rather than perfection or performance. So there was a lot here about a lot of work surrounding practice, tuning into the body signals with curiosity and not urgency. And again, as I mentioned earlier, parent involvement here was very much essential. So there was a lot of coaching that I had done with parents to really help them as well, kind of shift their perspective or language from, an accident to a success or to body communication. So really reinforcing the idea that the body is just trying to help you, not work against you, right? And that reframing for parents as well really helped Michaela even more so reduce shame and then also just made home routines calmer and more collaborative. And so this is a little bit more about some of the areas of concern that I just kind of touched on there. So there was, when parents referred her to us, there was definitely a lot of anxiety occurring before school, very closely tied to the fear of accidents. She also had a lot of avoidance. She would tend to restrict what she was eating before doing going on certain outings or like engaging in extracurricular activities. That was really impacting her symptoms and diet. A lot of difficulty with communication surrounding her bathroom needs at school, which is not uncommon even for adults in the workplace, right? And then a lot of that emotional shutdown and sensory overwhelm was occurring all at once, like I mentioned. And this is a little bit more about that treatment approach, but I'm going to explain that a little bit more thoroughly in a second here too. So this is pretty typical for a lot of patients that kind of are, maybe looking for more short-term care. So after about 13 sessions, Michaela was able to eat again before school and before outings, which was huge for her. There were very big reduction in shutdown behaviors. And even parents were starting to say, like, the home just feels so much, less intense or less tense. And so very powerful outcomes, not just that symptom change piece, which is of course what we want, but really that greater confidence and connection, which I always say is really what helps us in the long run. Of course, we want the symptom reduction and change, but really what helps us sustain that and see that long-term benefit is that confidence and that connection to the body in a healthier way. All right. So I've just spent a lot of time talking at everybody. Any questions so far for me? I'm just going to pause here for a little with some of those, as all those questions on cost and insurance are very important, of course. So first, let me just give a little bit more context into the treatment. I kind of like briefly touched on this periodically throughout the session. So all of us are trained in those two gold standards for GI conditions and symptoms, which is that CBT for GI and clinical hypnosis that we talked a lot about. And then, of course, just like most group practices, we all have other, modalities that we like to use and are experienced in as well. But we all have the same training in those two gold standard treatments, which is really great. So that way, of course, we're always thinking about like matching the patient with the appropriate provider for important reasons, but we're all getting that same training, which is great. Typically, sessions are going to look like most standard psychotherapy sessions. So like weekly, usually to start, 45, 50 minutes is typically the length of that session. We definitely do a lot of more short-term care around that 10 to 15 session length, and then certainly long-term as well. We're never pushing anyone away, but we want to emphasize that we do short-term care as well because of the cost piece, which we'll talk about. Of course, we do a lot of individual psychotherapy, but we also have group options that we'll talk about too, and those are lower cost, which is nice. And then again, we typically see patients 6 and up. We have we do a lot of emphasis on that care coordination piece, as I mentioned before. So, of course, with patient consent, we really love to be able to collaborate with other providers on the team. This link here just kind of talks about, what providers can easily do to refer patients to us as well, so that it's even easier on the patient. And again, we can see patients all throughout the nation, which is awesome. Okay, so for costs. So right now we are still out of network, but we have some new and exciting things, which is really great. So we do provide these, they're kind of like a specialized invoice. Some of you may have heard of this if you've seen a specialist or a provider that didn't take insurance, called a super bill. So it will have all of the information on it that you need to submit to insurance each month to get that reimbursement back. Because what we do is such a niche thing, like there's maybe 500 or 600 gut brain therapists in the country and thousands of patients that have GI issues or conditions. We do have a lot of success with getting things we call reimbursement for out-of-network mental health. There's a couple terms insurance companies will use. Usually it's like a single case agreement or SCA, or a gap exception, which basically means you pay upfront, and then they basically will reimburse you back as if we were in network. So let's say like if you saw an in-network therapist, you'd have like a $10 copay after each session, you would get everything back but $10. So that's something that we are very frequently assisting pretty much all of our patients with if they'd like to apply for. We have a really strong admin team. So that's something that we usually can fight for with insurance because of what we do and it being such a niche practice. But these are our standard fees. So that first appointment is always going to be longer. There's a lot of information to gather. So that's like about an hour. That is our $325 fee and then $250 for follow-ups. But we do have lower cost group options too, which is really great. We have a GI skills workshop, two of them that kind of run on rolling bases throughout the year. Right now, we have one for adults, 18 plus, and then one for adolescents. And we call it a workshop, so this is not therapy. Um, so um, while we're licensed in all 50 states plus DC, we don't have any restrictions on, who's running the group in terms of the clinician and where they're specifically licensed because we're not doing therapy. And this is more short term. I think it's right now, what is it, about 6 or 8 weeks. It's a very like flat one rate fee. And you're just learning skills to really support those GI symptoms. So it's still backed by that like CBT for GI and clinical hypnosis piece that a lot of patients are coming to us wanting to gain because of that specialty care that we can provide, but really given in that more skills lens. And I'll send all of this over to Julia and the team after too, so everyone can take a look. And then we do have therapy groups right now too. Right now, though, the one that we're running on a rolling basis is specifically for IBD patients, adults with IBD with Crohn's or UC. And then we have another group actually for parents of kids that have encopresis or other like toileting concerns. So I'll send some info too. But those are more lower cost, like shorter term options. And we do have a free tool now on our website, which is really great. I've had a few patients say that they enjoy using it. Um, it's called Reimbursify, so it doesn't cost any money to just take a look, and it'll basically tell you what your out-of-network reimbursement would look like if you didn't go that single case agreement or gap exception route. And so that's already on that website. Anyone can use it for free. And then we always have our free 15-minute phone consults too. So there's no pressure if, treatment isn't right for you. So those are all things I can share more about via email if everyone's interested there. Let me just see chat box if anyone has questions about that. Do you need a GI workup? Oh, great question. No, I mean, I would say most often, um, our patients have at least seen some type of specialist. Typically it's a GI, but it's not uncommon if it's another specialist, right? Like a neurologist, of course, or different types of surgeons, pain management, even psychiatry, things like that. Um, if there is a lot of like complex GI symptoms going on and we don't have any gauge of like if there's anything else structurally going on or if it is just functional in nature. And I say just, I don't mean to say that it's not as impactful as structural because it certainly is. But just important for us to know a little bit more about what that looks like. And let's say you haven't seen a GI or it's been a really long time or there haven't been any tests done at all. It doesn't necessarily have to be a scope like a colonoscopy. Then we might want to just encourage just getting a checkup from a gastroenterologist because we just want to make sure that you're healthy enough to obviously engage in the care. But that really doesn't happen quite often, just mostly in severe cases. And I would say most often everyone's coming with some type of specialist on this team that they have to see regularly, right? So if it's not a GI, it's probably a neurologist or another specialist that you're coming to treatment and you're already having them on your team here. Um, so this just again explains a little bit more about the pathways for insurance reimbursement because, I know that obviously patients, families affected by spina bifida, you're juggling so many medical appointments, approvals for equipment, medication, supply coverage, specialist visits, and it's a headache and it's a full-time job in and of itself, apart from just working full-time or part-time or just like managing your condition, which is another full-time job. So I always want to make sure to highlight that like we might be able to do something to get some reimbursement. So that can be really effective because it's so hard to find in-network therapists these days, and especially those that are gut brain therapists or GI psychologists. And this is one of the handouts that I'm actually going to share with Julia to disperse. So don't feel like you have to get everything down right now. That'll be sent via email. And I really explained most of it before. But yeah, so we can look into getting we can look into learning more about what out-of-network reimbursement for mental health care is with your current insurance plan and or try to obtain that single case agreement or gap exception so you're actually getting most, if not all of the reimbursement back each month from insurance. And this is a little bit more just about how to contact us here. So we have our website, we have our general number, you have our admin email and my email as well. A lot of different ways to learn more. So you can go to our website. You'll see there that there's, an FAQ page. If there's other specific questions that I couldn't answer today, those should all be included there. Or feel free to just email our admin team and they will be happy to help you. They're wonderful. We're so happy to have them. And you can also schedule either through that admin email or through calling that our main line here, or even just directly on our website, a 15-minute phone consult. That's free of charge. So you'll be connected with a patient care coordinator who can go over more about like what you're looking for from care, talk about potential options for providers that you could see depending on licensure and what you're interested in. And all of our bios are on there too, so you can even take a look, before scheduling that consult if you want to ask specific questions about those clinicians. And they'll obviously talk more about all of the logistics in terms of the financial piece too. Um, so that's something that you can always sign up for free, or you can just inquire to learn more before doing so if you'd like. If you're really not looking for treatment or just not ready yet, or just want to learn more about us or just this field, we have a lot of great free resources on the website. Our Brain Bites is our new short video series that patients are really enjoying. So that's up there for free. There's blog posts that are free. There's other handouts, websites, colonoscopy tips, like all the things that often come when we have these GI symptoms. So feel free to check it out. Lots of good stuff there that's free. And then certainly if you wanted to sign up for our newsletter, we don't spam anybody. We tend to just keep things like once a month or so, but sometimes that can be helpful too, as well. And I see another question here. So let's see. Yes, the vagus nerve. So that is a big, big talking about the vagus nerve and what that looks like in terms of our treatment is something that we definitely talk about with every single patient to some extent, depending, of course, on their age and developmental level. So great question. Yeah. And we know there's a lot out there now about like vagus nerve stimulation products and apps and things like that. So it's definitely like this buzz a term which kind of sounds weird, as a clinician, because we've been talking about it for years. But with social media, TikTok, and things like that, there's good and bad that comes with it, and certainly a lot of it's good. But I know that that's something that a lot of people are like learning more about and wanting to talk about, which I love. So I'm happy about that. And basically, with clinical hypnosis, like we're going to tap into that vagus nerve. And for anyone that doesn't know what the vagus nerve is, it's the longest nerve in our body. So it starts, pretty much at the spinal cord or at the brainstem and goes all the way down the spinal cord. And so it's that longest nerve in the body that actually directly taps into our GI system. So when we learn how to calm things down in the nervous system, especially tapping into that with some vagus nerve stimulation, like doing things that are mind-body treatments like clinical hypnosis or somatic therapies, which I also specialize in, we can then calm down the gut. So it's pretty much just like what we talked about earlier with that gut-brain connection. And there's also a lot of ways that we can stimulate the vagus nerve, and we don't necessarily have to, only do them with a therapist, right? So like we can practice humming certain sounds if we're in pain or in distress in some way, which might sound silly, but it really can be helpful. So like sounds like an M sound, and really focusing on how that humming feels in our throat and like closing our eyes and just trying to calm everything down. We know that that taps into our vagus nerve. There's also different pressure points in the body that we can touch or manipulate that actually can tap into that vagus nerve, and then therefore calm down the nervous system, and then therefore calm down the gut or bladder. So there's a lot we can do there, even beyond, like psychotherapies as well. And we might even have a handout or a blog post about that on our website that might be free. And if we don't, you just gave me the idea to consolidate all my resources for patients and write one. So then if you don't find it, stay tuned because I'll definitely put that up there. But yeah, that's definitely something that we're going to tap into when we're doing our work, especially given it's that core nerve in our body that we really want to calm down so that everything else can calm down as well. So kind of the simplest way to put it. I just signed up for Brain Bites. Yay, that's awesome. our team that's behind that, I can't say I'm one of them, but our team that's behind it's going to be really happy to hear that just as much as me, if not more. Um, oh, you asked your neurosurgeon about it. He wasn't familiar. Oh, hmm. Okay. I don't know if I don't know. I can't imagine why. Um, but that definitely should be something that they would be familiar with. But yeah, that's really interesting. That they weren't aware of what the vagus nerve is. But honestly, and I'm sure your neurosurgeon is wonderful. A lot of these more how do I word this? Like the mind body treatments and therapies and these, what a lot of medical practitioners used to and some still do consider as like alternative treatments, really, really makes it so that patients are not really getting the best education that they can and then making the best decisions for them and knowing what treatments are out there. And that's why a big part of our mission is not just our work with our patients directly, but also with other providers to really get the word out there about what we do. And even in terms of, our GI specific conditions that we of course specialize in, I can tell you that there's gastroenterologists that didn't know that we were out there. They had heard about gut-brain therapies, but they really want to learn more about condition-specific CBT or clinical hypnosis, right? So it makes sense that then maybe even a neurosurgeon might not also know, even though I would think on the nerve side that they would probably have a little bit more insight there. But that's why it's so important to us to really focus on making sure that we're, partnering with other organizations and professionals so we can get that word out there. And, specifically as someone who's had Crohn's disease or, IBD since I was 9, I can tell you that this was not something I had heard about either growing up or even in young adulthood before I really got into this field. So, it's so needed and it really is not, it really needs to be a part of our collaborative care approach across the board and for our patients to get that really great wraparound care as well that they need. But yeah, thinking about that vagus nerve as that main communication pathway between the brain and the gut. And maybe if you even decide that you want to go back to your neurosurgeon and tell them that you learn more about it, that would be really great. No pressure, of course. That's not your job. But if you wanted to, I think you have a lot of good insight now, hopefully, from my presentation to be able to do that there. Yeah. Let's see. Sorry, the chat box keeps disappearing on me. So here we go. Where is it? Oh, binaural beats to help me sleep at night. Awesome. Yep. Yeah. There's so many great resources out there that really can tap into the vagus nerve. And then, what we think about nervous system, we think about like the sympathetic and parasympathetic, right? So parasympathetic is that nervous system that we want to tap into. That's like our rest and digest. And the sympathetic is that fight or flight, right? Especially when we get really, really stressed or we're having a symptom flare, whatever's going on, that's really disturbing our peace. And so the vagus nerve, tapping into that vagus nerve, we know from research has been proven to help regulate things like digestion and bowel motility and pain perception, and even like, heart rate and breathing and emotion regulation, because it then taps into that parasympathetic nervous system so we can rest, digest, and regulate. And even when we do have those stressful moments or flares or whatever that is, what's really wonderful is not just in the moment does tapping into that vagus nerve or doing these vagus nerve stimulation activities or treatments helps, but also long term, then our bodies will start to learn that they can settle more easily after stress, right? So kind of connecting back to what I mentioned earlier, like that symptom reduction piece is so important, but long-term wise, we really want the body to relearn how to interpret those signals so it can calm itself down so much more easily. And then therefore you have that control back and that sense of safety, which of course is huge when we're living in, a body with a chronic illness, as you all know. Yeah. Oh, wow, that's really cool, especially in the 80s. Yeah. There's a lot of devices out there now too. I don't know a ton about them, but I know that some of my colleagues have been like, connecting with some of those companies and things like that to learn a little bit more. But to hear that even in the 80s, some of that was out there is really, really cool. That's awesome. Yeah, and even like I mentioned, like gentle humming or one of the things I teach oftentimes to my patients is something called a butterfly hug or tapping that maybe you've seen somewhere in social media before, which is an example of how we can tap into that vagus nerve and then calm everything down and really get into that parasympathetic shift. Yes, Lisa, exactly. Yeah, because the collarbone has these really nice receptive pathways. So where when we manipulate by pressing, not obviously, in a painful way, but firmly enough, we can actually calm everything down. So yeah, kind of making those butterfly hands and resting on the collarbone or even like the shoulder bone if you want to spread out into a bigger butterfly and then just very slowly tapping, but firmly enough to really feel it. And even just closing your eyes and doing some slow breathing, that can really, really help and reduce that sensory overwhelm, right? Or that shutdown as well. And I love it just because I see kids and adults and it's adaptable for all. So it's a quick and easy thing that we can pretty much do whenever, which can be really, really help, especially with spina bifida, because we know that amplification of symptoms is so common, even when medical care is appropriate or when we're, some type of whatever it is that we're experiencing is in remission or we're not in a state of flare or a lot of physical distress, but our nervous systems are still responding as such, just given the years and years of struggle. Yeah. Well, any other questions as we're finishing up here? Because I can stay on for, at least until 7:10 or even 15 if any.